it comes to the piriformis muscle, a lot of people confuse the piriformis stretch with the figure 4 stretch. So Kim's going to demonstrate the figure 4 ankle over the knee, just like that. They put their hands behind their leg, and people think that they're stretching the piriformis on this leg, okay? The challenge with this is that this leg, if we put this leg down straight here. So I'm going to keep her hip bent like this. The primary action of the piriformis muscle, its purpose is to produce, I'll keep her leg straight, this is external rotation of the hip, which this is external rotation of the hip. If I'm trying to get the muscle to relax, I don't want to put it in its contracted state. This is internal rotation of the hip, which puts slack on the piriformis muscle, if that makes sense. The other thing is that the piriformis muscle attaches on the anterior surface of the sacrum and goes down to the upper 2/3 of the femur. So it's a diagonal muscle, okay? So we need to follow, if this piriformis muscle runs this way, to stretch it, I have to stretch it in the same fiber alignment, if that makes sense. So that's what we're gonna do. So we're gonna bring the right leg up as far as we can. We're gonna put both of our hands, let's do it together now, on their back. I'll wait for you to catch up. Put both of your hands behind the client's knee. So I brought Kim's leg up to her body and a little bit over to the opposite shoulder. And my elbows are locked, my front leg is bent, my back leg is straight, and my back is flat. So she's gonna take that deep breath and she's gonna try to push her leg out into abduction, and I'm gonna resist that action. Okay, ready, Kim? Take a deep breath. Push out sideways. Push, breathe, keep pushing, breathing. When you're out of air, stop pushing. Okay, isometric contraction number 1. Now, at hand and stone, we're gonna bring your leg down here. At hand and stone, we can't put our fingers, we have to stabilize her hip to make sure that when we do the stretch, her whole hip doesn't come off the table. So what I'm saying to you is, we're not gonna allow this to happen here. So how do we prevent her hip from coming up? Well, we have to isolate and push down on this ASIS. So because of the no touch zones, we're gonna take our client's hand, put it on the ASIS, and then our hand on top of our client's hand. Okay, so let me go back to what I was saying. Both of your hands were behind the knee. Let's get to this position again. Everybody do this with me. Okay, so you're gonna keep your foot hand behind the knee, and your head hand is gonna be placed on the client's hand on their ASIS, right here. Okay, now my arms are locked. Good, looks good, everybody. So now the client's gonna take a deep breath, and as she exhales, I'm gonna push her leg up and over to the opposite shoulder. Now, where do you feel? Piriformis or inguinal area? Okay, so you feel in the groin, right? Okay, so right now where Kim should be feeling it is in the piriformis back here, but she feels it in the groin. So we have to stop, and we have one small modification we're gonna do. We're gonna go back to our sheet that we had earlier that we put behind the knees, and we're gonna make a little mini bolster. So we're gonna make a little mini bolster with the sheet, and then we're gonna lay this. So if you remember your physics from high school, remember levers and fulcrums? This is now gonna become a fulcrum right here in the inguinal area. So this leg is a lever. So now we put our hand over the sheet and we push down, bring our hand back behind the knee. Okay, now take that deep breath. And as we exhale and we go across that way, you still feel it in the groin as much. Okay, not as much. So now the other thing we can do is one slight change. Going straight to her nose would be 12 o'clock. This would be 1 o'clock, 2 o'clock, and straight off her body would be 3 o'clock. If I just slightly change the angle a little bit, what do you feel now? Piriformis or groin? Okay, What do you feel now? Piriformis or groin? Okay, what do you feel now? More to the piriformis, and one more time. Okay, so I have to change with Kim. Instead of going directly to the opposite shoulder, I had to kind of come over here to like mid-humerus for her to feel it less in the inguinal area and more in the piriformis area. Okay, so you might have to do those slight tweaks. Make a little bolster, because what she felt was a pinch right here in the groin area. It will happen, not to everybody, but some people have that happen. Now we're gonna finish. Hold on, that was one part to this. Let's go back to where we were, everybody. So let's just say that our client does have active sciatica right now. We got to this third stretch, that's all we're gonna do. But if my client doesn't have sciatica, my hand that's on her hip is gonna go back to the knee, behind the knee. My hand that's behind the knee is gonna go to the ankle. Okay, and now when my client inhales, I'm going to internally rotate her hip, which puts more slack on the piriformis muscle. Because remember, this was external rotation, this is internal rotation, which makes the muscle more relaxed. Does that make sense? So we're only going to add the rotation parts if they don't have sciatica. If they do have sciatica, we're not going to add any rotation. So we'll keep this handy just in case we need it. We're going to put both of our hands behind our client's knees. Our front leg is going to be bent. Our back leg is straight. Our backs are flat. Okay, the client's going to take a deep breath and they're going to try to push out sideways. Ready? Take a deep breath and go. Push, breathe, push, breathe, push, breathe. And when they're out of there, they stop pushing. Our head hand is going to go on top of the client's hand over the ASIS to stabilize the pelvis. And we're going to take a deep breath, and as they exhale, take the leg up and over. Where do you feel this, kid? Piriformis on this side. Okay, inhale again. More piriformis this time, not so much the groin. And then one more time. Pretty good. Okay, so if Kim had sciatica, this is all I'm going to do. If she doesn't, my hand that's on her hip is going to come back behind her knee. My hand that's behind the knee is going to come to the ankle. And then she's going to inhale again. And we're gently going to add internal rotation. And that's it. But only if they don't have sciatica.